Good morning, doctors. So today we are going to talk about making differentials in the diagnosis of disease. I thought of making this video because a couple of people requested me to share how I was able to make some differential diagnosis and how I'm able to make differential diagnosis as I take care of patients in the clinic or in the hospital. So in differential diagnosis, the last thing you want to think about is, getting stuck while you're asking patients, what their symptoms are and trying to rule in or rule out other conditions. You want your differentials to be at your fingertips, and you want to be able to remember them quickly enough to verbalize as you ask the patient question. So I had a problem, I'll be honest, I had a problem remembering all the differentials to ask, and I would get stuck, as I had said before, because I ran out of questions. And there are many mnemonics out there to help you remember differential diagnosis, but you can't remember all of them. Most of the time you remember the mnemonic and then you'll forget what it was meant for in the first place. So this is what I devised. So I decided to always find my answer in the question. And there are a couple of ways. Let me just get my notes up. So one of the common one, is vindicate, V-I-N-D-I-C-A-T-E. This one we learned like in medical school, for every differential diagnosis you want to, it can have a vascular origin, that's the V. I is infection, neoplasm, degenerative. It could be because of, caused by the doctor, iatrogenic, caused by alcohol, intoxication. It could be congenital, autoimmune, caused by trauma. And finally, the E is, it could be of endocrine origin. But it's hard to use vindicate all the time when you're asking patients for their diagnosis. So anyway, let's get to it because I have a lot to cover. I'd like you maybe to start remembering differentials by looking at the presenting symptom. So if the patient says that they are tired, the differentials are hidden in the word tired. Or if the patient presents with back pain, the differential is hidden in the word pain. If the patient presents with palpitation, I found a way to make differentials from the word palp. Okay, let me give you an example. It will make more sense. Okay, so the patient presents with back pain. What are the differentials for back pain? It's in the word pain, P-A-I-N. P for prolapsed disc, A for triple A, I for itis. So you're thinking this back pain has been caused by spondylitis, osteoarthritis, pancreatitis. N for neoplasm. So you're thinking some cancer, multiple myeloma, prostate cancer. And S for stones. So they can be renal, urethral, and another S for sports injury. So it'll be easier for you to remember, okay, I need to ask about if it's a patient presenting with back pain. Let me just go through the word pain. P for prolapsed disc, A, triple A, I, itis, N, neoplasm, S, stones. All right, another patient presents with tiredness. Differential, I have the mnemonic tired's off. T-I-R-E-D-S-O-F. So tired's off. So tiredness can be caused by thyroid problems, hypothyroidism. It can be caused by ITP. It can be caused by inhalers. The R, I kind of changed leukemia to be leukemia. So it'll remind me of cancers. R also for renal disease like Addison's and Cushing's. E can be some medications like citalopram. So S citalopram, EES, ESCITALOPRAM. D for diabetes. So you're thinking of hypoglycemia can cause this tiredness. Another D for tiredness is depression. And then the S is SIADH. O, obstructive sleep apnea. And F for fibromyalgia. So now when you're asking the patient questions, you ask things like, okay, any weight gain, any lethargy, constipation, cold intolerance, any bruises, body pain, bony tenderness for ITP, any history of infection, fever, bruising, bleeding gums, any abnormal lumps, bumps, swellings, weight loss. So now I'm literally going through the word tired and asking all these things. So any medications like steroids, antidepressants, if I'm on the D now of tired, any nausea, tremor, shaking, dizziness, hunger. This is for diabetes, for hypoglycemia, or for obstructive sleep apnea, any trouble sleeping, feeling tired in the morning, snoring. For fibromyalgia, you ask any pain in the shoulders, muscle pain, increased sensitivity to pain. And literally in less than 2 minutes, you'll have gone through a list of maybe 3-4 differential diagnoses, and it'll flow. All right, let's move to the next one. So the patient presents with palpitations. The mnemonic is PALP, P-A-L-P. So panic attack can cause palpitations, arrhythmias can cause palpitations. And then the L, I said a large heart can cause palpitations if you have ectopic heartbeats. A large thyroid with goiter can cause palpitations. And some pills like your pump inhalers, drugs, and I also added caffeine. All right, hope you have a pen and paper because I'm going really fast, or you can just rewind the video. Okay, a patient presents with chest pain. I have, this one is common, it's the 5 Ps of pleuritic pain. So you have pericarditis, pulmonary embolus, pneumomediastinum, pneumonia, pneumothorax, and then you can always add in trauma and myocardial infarction. A patient said that they fell down. So the mnemonic is falls, F-A-L-L-S. So F for they could have fallen because their blood sugar is high or low. I also put another F for fundoscopy because they could have fallen because of eye problems. A, again, for arrhythmias, they could have fallen because of abuse. They could have also fallen for aortic stenosis. Another cause of fall is in the L, leg weakness, low blood pressure. Another L is loss of consciousness. And then the S, they could have fallen because of a seizure, a stroke, a slippery floor. And I also added sepsis in there just to help me ask about any recent infections. Okay, a patient complaining with eye problems. I always did this and said the mnemonic for eye problems is GMC traumas. So G for glaucoma, giant cell arteritis, M for multiple sclerosis, C for conjunctivitis, T for trauma, and S for subconjunctival hemorrhage. So that's how I remember any eye problem. I just think, oh my gosh, GMC trauma. Okay, a patient comes in with confusion. The mnemonic is CONFU. So C-O-N-F-U. C for CVA. Another C is CRP. So the confusion can be caused by infection. So I want to ask about UTI, URI, gastroenteritis, and meningitis. The other C can be cognition problems like dementia. Then the O is the oxygen can be low. And then for my Nigerian friends, the word for alcohol in some Nigerian language is ogogoro. So I remember confusion can be caused by low oxygen and ogogoro, which is alcohol. N, new medications. So I'm thinking of diuretics can cause it, steroids can cause it, opiates can cause it. And then F, FBS, so your fasting blood sugar can be high or low. That can cause confusion. FITS, F-I-T-S, can also cause confusion. And the U is just something to keep me encouraged, is you got it, keep going. All right. Let's do another differential diagnosis. So a patient comes in with stomach pain. And for my differentials, I have the word abdomen, A-B-D-O-M-E-N. So appendicitis, acute gastroenteritis can cause stomach pain. B, bloating. And so I'm thinking of celiac disease causing stomach pain. Hyperthyroidism can cause bloating also. Then the D is diverticulitis. O, ovarian torsion, obstipation, constipation. M is for medications, can cause stomach pain, so antibiotics that cause C. diff, laxatives, opiates. E, ectopic pregnancy, esophageal reflux with GERD. And then N, the last letter for abdomen, neoplasms. So I'm thinking of asking questions about cancer, any weight loss, any abnormal swellings in the bodies, any lumps or bumps, fatigue, loss of appetite. So the answer is actually in the question. You don't have to keep thinking, oh, what differentials do I have for confusion? You know, it's in the word CONFU. What differentials do I have for stomach pain? It's in the word abdomen. For falls, it's in the word falls. So it actually helps, maybe it helps me take a deep breath in, and I can listen to the patient more. I'm not wondering, my mind is not wandering. I'm present in the patient interaction. And also I am competent because I am going through a list of things systematically. Okay, if a patient, let's continue. If a patient complains of hematemesis, I think of the acronym BLOOD. So B, blood thinners can cause it. And then I have BARF, which is another word for vomiting, BARF. So I'm thinking of Boerhaave, I'm thinking of Mallory Weiss, so I can ask the appropriate questions if they've been vomiting or retching, alcoholic history. And then L is liver varices, which can cause hematemesis with portal hypertension. Then O, OTCs, over-the-counter meds, NSAIDs, ulcers can cause hematemesis. And the other O is oral surgery. So I'll ask them if they've had any recent procedures to the mouth, if they've had any injuries. And then D, I think of hematemesis being caused by death causes, so radiation and hemorrhagic fever. Dysphagia, a patient comes into the clinic and they're complaining of dysphagia. What differentials am I thinking of? I'm thinking of the word dysphagia, but this time I spell dysphagia with an I and not a Y. So DISPHAGIA. Number one cause of dysphagia, don't forget cancer. I, infections like CMV and esophagitis. S for spasms and strictures. P for pharyngeal pouch like Zenka. And then the other P, I have palsies, so I don't forget multiple sclerosis, ALS, CVA, Parkinson's. And then H is for hystericus, like global hystericus, where they feel a lump, a sensation of a lump in their throat. A, alkalasia. G for GERD. And then I have instruments and iatrogenic trauma. All right, so that's how I remember to ask the questions for dysphagia. For dementia, my mnemonic is dementias. So I hope you're getting the flow, you know, to really, you don't have to stress about thinking of differential diagnosis. The answer is always in the question. Dementia, so dementias, so drugs like sedatives, narcotics. E for endocrine, I'm thinking hypoglycemia, hyperparathyroidism, hypothyroidism. M, metabolic causes like hyponatremia, renal, hepatic failure. E, emotional causes can cause dementia. Then N, nutrition. So are they deficient in B12s? Are they deficient in niacin, thiamine? The other N, for dementia, I think of NPH, which is normal pressure hydrocephalus, which can cause some sort of dementia. Of course, you'll ask about, you know, any changes in gait or any urinary incontinence. T, they can have a tumor. They can also have trauma. And then I also think of thyroid problems with, actually, no, let's not put thyroid in there. Let's just think of tumor and trauma when it comes to dementia. Then I think of infections that can cause dementia. So I'm going from TB, cryptosporidium, herpes, AIDS, syphilis, Creutzfeldt-Jakob, which is a mad cow disease, and then atherosclerosis, which leads me to think of CVAs. Another A for dementia is Alzheimer's, and that's about it with dementia. Okay, patient comes in and they're complaining of diarrhea. I think of diarrhea. So D, it can be caused by drugs like laxatives, antibiotics. Another D is diverticulitis. I, irritable bowel syndrome, infarction of the bowel. So if they have a history of AFib. Another I can be a viral infection. I'm thinking of infections like Salmonella, Shigella, Campylobacter, C. difficile, Yersinia. I'm thinking of cholera, E. coli, Giardia, amoeba. So this my I in diarrhea really goes into a history of travel history. Are they eating food outside from street vendors? The A in diarrhea, I think of autoimmune diseases like ulcerative colitis. I think of Crohn's disease. Another A is AIDS, you know. And then the R would be, I think of rapid transit, like RAPID, transit, TRANSIT, meaning dumping syndrome. So there's a rapid transit in the body. So I'll ask for any surgeries, any bowel corrective surgeries or weight loss interventions where the bowel was shortened. The other R for diarrhea, renal failure. Then H is hypersecretory, so Zollinger-Ellison syndrome. E, I think of endocrine causes of diarrhea, so hyperthyroidism. And then the last A, I think of absorption problems, so pancreatic insufficiencies, celiac disease, and I also add like an L, so diarrheal, and just to make me think of lesions, you know, or neoplasms or cancers that may be causing some obstruction. So the patient will complain of constipation and a mix of diarrhea and constipation. Okay, hopefully I'm not going too fast. The next one is dyspnea, so shortness of breath. My mnemonic is acute dyspnea. I think I found this on maybe a website somewhere. Acute dyspnea would be the mnemonic to remember for differentials in dyspnea. So A, asthma, airway obstruction, angioneurotic edema, which is a C1 esterase deficiency. And the other A is aspiration, excuse me. And then the other A can be altitude sickness. So did they go up a mountain? Were they hiking? That way your questions are very, very varied and you have a broad way of capturing information. So A, asthma, airway obstruction, altitude sickness, angioneurotic edema, aspiration. C, COPD, carbon monoxide poisoning. U, upper motor neuron lesion. T, tracheal obstruction or tamponade can cause dyspnea if it's really severe. E, endocrine problems. So I'm thinking endocrine and environment. So again, if I don't remember carbon monoxide toxicity, I can remember it with the environment. They could have a really large goiter, but of course you will see that in your assessment. D, they can have a deformed chest wall. So you're asking about trauma, any flail chest. The Y is hyperventilation syndrome. S can be shock, can cause dyspnea. Sarcoid can cause dyspnea if the lungs are really bad. And then P, the last, did I even spell it correctly? ACUTE DYSP. So acute DISP. Sorry about that. And the last P, I think the last things that are causing dyspnea are the 5 Ps of chest pain. So as I had mentioned before, pericarditis, pulmonary embolus, pneumonia, pneumomediastinum, and pneumothorax. Okay, and then N is neoplasm, can also cause dyspnea if there's obstruction or a space occupying lesion that's obstructing the airflow in the lungs. E, edema, which can be cardiac or non-cardiac causes. And A, thinking of anything with the A, so aspirin toxicity, which is in acidosis. Anemia can cause some shortness of breath or dyspnea problems. DKA can also cause dyspnea, especially if they're acidotic. So just think of acidosis and some of the reasons, and then you can always add anemia. Okay, the patient presents with earache. I think of otitis, so O-T-I-T-I-S. So it can be other referred pain to the ear. So it can be from the parotid, it can be from the tooth, or it can be lymphadenitis. And then TMJ, joints can cause earaches. Your big one is infection, so otitis media, otitis externa. Meningitis can also cause it. T for trauma, so you're thinking of barotrauma. You're thinking, you're asking them, do they listen to loud music? Have they been to any, been near any loudspeakers? You're also thinking of how they clean their ears for barotrauma, any plane rides. You're also thinking of blunt injury. Okay, so OTIT trauma. I, impaction, which is a wax or cerumen. I also for insect, any insects could be in there, or foreign bodies, so impaction. And then S, you're thinking of a syndrome like Ramsay-Hunt or a facial neuralgia can cause an earache. Okay, eye inflammation, I think of iritis. I know I said eyes also, I did GMC traumas. So another way to remember eye inflammation is by iritis. So eye can be increased pressure with ICP. It can increase pressure with acute closure glaucoma. And then R, reduced tears, so a dry eye, keratoconjunctivitis, Sika syndrome. I, again, iritis, so some infection of the conjunctiva. T for trauma, so foreign body, abrasion, so any trauma you will investigate on that. And then I had mentioned another eye, so infection, again, conjunctivitis, it could be bacterial, viral, allergic reaction, chemical. So have they been putting any eye drops in? Do they have any, contacts? So infection from contact use. And then the last S is scleritis or subconjunctival hemorrhage. So let me just go through that. I think I made a little bit of a mistake. So when I'm thinking of eye inflammation, I'm thinking of the acronym iritis, I-R-I-T-I-S, I for increased pressure, R for reduced tears like Sika. Then I, in the iritis, I is iritis again, T for trauma, the next I is for infection, and the last one is for subconjunctival hemorrhage. Mrs. Jones presents with hematuria. What am I thinking of? You got it. Hematuria is, the answer is in the question. So H, hemorrhagic cystitis. E for exercise. So maybe they've had rhabdo. The other E can be endocarditis. M, medications. So analgesics. Another M for hematuria can be malignant hypertension, which causes some changes in the kidney function. The A, autoimmune disease like SLE, polyarteritis nodosa. T for trauma to the GU tract, so I'm asking for any instrumentation. U for urethritis. R for renal calculi, the stones. I for infarction, so do they have ITP, TTP, sickle cell, anything that can cause any damage or infarcts to the kidney. And then A, thinking of allergic neuropathies like Hemlock-Schönlein purpura can cause hematuria. Hypercalcemia, the mnemonic is calcemias. So carcinomas, cancers, have some of them have high calcium levels. A, antacids containing calcium. So I'm asking them questions about do they take calcium supplements? How much do they take? L is for leukemia, lymphoma, low phosphate will cause high calcium. Hodgkin's disease will also cause high calcium. C, any supplements containing calcium. I know that's a little repetitive with the antacids, but it kind of works in. And then E for endocrine. So hyperparathyroidism causes hypercalcemia. M, multiple myeloma, metastatic lesions to the bone, that will cause hypercalcemia also. I, iatrogenic, so anything caused by the doctor. Did they give them thiazide diuretics? Vitamin D also will cause hypercalcemia. A, Addison's disease, acromegaly will also cause hypercalcemia. And S for sarcoid, which one of the lab results is hypercalcemia. All right, patient presents with hypertension. I'm having, my blood pressure is high and it's not been managed. Well, by medications, you want to investigate further to see if there are other reasons causing hypertension. So when I hear hypertension, I think pressure. So P, pheochromocytoma, polycythemia vera, preeclampsia or eclampsia. And then a renal vascular reason like renal artery stenosis. The E again is for endocrine, so hyperthyroidism, Cushing's disease, aldosteronism. In some cases of hyperparathyroidism present with hypertension. S, I think of substances like estrogens, substance like caffeine, cocaine, sympathomimetics, and alcohol withdrawals. So the S in hypertension, think of just substances. The other S can be structural, which can be a coarctation, aortic insufficiency, or arteriosclerosis. U, upper motor neuron problems. So it's kind of indirectly. So I think upper motor neuron problems and increased intracranial pressure. R, I think of renal, so diabetic nephropathy, glomerulonephritis. And then E, I think of essential hypertension, which is, 90% of hypertension is essential. And then the other E is an error in cuff size. So that's how I remember hypertension. Patient presents with shock. So I think of shock, like, an American saying it like I'm in shock, okay? SHACK. Sepsis, hemorrhage, so blood loss, head injury. A for anaphylaxis, C for cardiogenic causes, and K, I remember potassium, which reminds me of a metabolic imbalance, and toxins, which can cause shock. The patient presents with syncope. So there are different ways you can remember syncope: by fainting, or I like to remember it by saying syncopal, which I spell in a different way, SHNCOPAL. So S, the first one, syncope, seizure, of course. Then the next H is hypoglycemia or hyperventilation, if they have a panic disorder. N, new medications. N for neuropathy, which reminds me of diabetes. C for cardiac, so they can have an arrhythmia, an MI, aortic stenosis, pump failure. O for orthostatic hypotension, which is really, it should be actually higher up than some of these other differential diagnoses. So if I'm asking patient questions, and I don't want to ask all the differentials, I pick the key ones. So example, in syncope, I'm asking about seizures, I'm asking about hypoglycemia. I can skip, new medication and cardiac reason, but I have to ask about orthostatic hypotension. So SHNC, O, orthostatic hypotension. P, they can have pedal pulling from venous insufficiency. A, arterial insufficiency, and L for low blood volume. So I'm thinking of dehydration. They could have passed out because they are dehydrated, or they could be bleeding, so low blood volume. Okay, a patient comes in with wheezing. I'm thinking of the mnemonic asthmatic. So A, they can have aspiration, they can have asthma, so bronchospasms. S, from smoking or irritant inhalations, which leads me to ask about questions about any lung problems, any smoking, any secondary smoke. T, thyroid enlargement, which causes obstruction. H, heart failure or pulmonary edema, can present also with some wheezing. M, medications like beta blockers and aspirin. A, I'm thinking of angioedema with the C1 esterase deficiency, the big, they swell. And anaphylaxis also, which will also help with reminding you about swelling. T, I think of tumors can cause wheezing if there's obstruction to the windpipe. I, infection like pneumonia, bronchitis. I also think of iatrogenic causes with some wheezing or palsies, especially if they've had maybe a previous laryngectomy or larynx procedures. And then the last C for asthmatic, I usually just say cystic fibrosis for wheezing, which reminds me just to ask about any chronic problems. A patient presents with, I'm noticing that the color of my skin and eyes is a little bit yellow, so jaundice. I think of the mnemonic jaundices. So the first J is just before the liver. So anything just before the liver can cause jaundice, like hemolysis, Gilbert's syndrome, Crigler-Najjar syndrome. And then A, after the liver, so I'm thinking biliary atresia. Then U got cirrhosis, so intrahepatic reason. Neoplasms like hepatoma or a metastasis to the liver can cause jaundice. D for drugs, which is important with estrogens. INH for TB, NSAIDs, acetaminophen, sulfurs. I for infection, so you're thinking of the viral hepatitis A, B, C, D, E, thinking of mono, CMV, amoeba. And then C, for in the word jaundice, I'm thinking of carbon tetrachloride with dyes. I'm thinking of cholangitis can cause jaundice. E, ETOH for alcohol, and the last S is for stones. All right. Moving along, patient complains of throat pain or pharyngitis. The mnemonic is throat pain. So THROATPAIN. The first T, thyroiditis. Then P, herp angina or HSV. In the the lesions in the esophagus. R for a retropharyngeal abscess. Can cause throat pain. O, oral ulcers, aphthous ulcers, and then herpes. Then A, again, my angioedema with a C1 esterase deficiency. T for a toothache or a tooth abscess. P, peritonsillar abscess. A, you can have angina, which is not like chest pain, but angina. There's a type called Ludwig's angina, which is LUDWIG. Angina is like a cellulitis of the mouth floor. So I think of that. Pharyngitis can be caused by infection. So I'm thinking bacterial, H flu, mycoplasma, diphtheria especially, CMV, AIDS, HIV, and then fungal infections like Candida. So I'm asking about questions of whether they are immunosuppressed or they're on any steroids. Other infections like that present with mouth sores, like maybe syphilis and chlamydia. And the last one for throat pain is neoplasms. So throat pain can also be caused by some neoplasms. So we've gone through a lot. I hope that you'll be able to make differentials that are consistent with the presenting illness. If you have other methods of remembering, that's well and good. But this method has proven itself as tried and true in my career, and it helps me, relieve the pressure of having to think of what I need to ask the patient. The answer is always in the question. If you have any questions, shoot me an email, drlian@yahoo.com, or just leave a comment below, and I'll see you in the next video. Bye.